My name is Samaris, and I'm a managing director and our consulting business unit solutions leader. And in my nearly 20 years with Kaufman Hall, I have had a variety of roles and the opportunity to work across most of our practices. I think our clients are in a very different place when you think about the challenges they're facing. You've got nearly half of hospitals still today losing money, which obviously is a problem, and there's significant differentiation there. So you have a cohort of hospitals and health systems that are really doing quite well and kind of righted themselves coming out of the pandemic. And then there are a large number that are really struggling. When we think about urban safety net hospitals and rural hospitals, that cohort in general is really still struggling to a very large degree. It really goes beyond, in a lot of cases, the traditional blocking and tackling around cost reduction at this point and getting into what can we offer to our communities, and that's a really hard conversation for a lot of those organizations. When we think about our academic medical center clients, the challenge is a little bit different. Many of those are still struggling financially, and a lot of them are doing quite well, but I think a very common thread among AMCs right now is looking at growth paths and really asking the question of, is my funnel large enough to really feed my tertiary and quaternary business, both the business side of it, but also very importantly, the research and education side of what their mission is. When Kaufman Hall is brought in to help clients solve their problems, I think we typically start with making sure that we've clearly identified what is the issue that we're trying to deal with. So, are we clear, and is there consensus around the problem that we're trying to solve? And then really importantly, what's the range of solutions? So really trying to push our clients to be broad in the thinking, at least initially, of what are potential solution sets. And then building a comprehensive fact base on that, using the best data that we have available, and to the best of our ability, trying to remove a lot of the emotion from the conversation and help them get to the point where they can have an informed dialogue about the alternatives available, what the implications are financially for their communities, for their physicians, strategically, what their competitors are likely to do. So really kind of putting on the table all of the fact points to try to guide our clients through informed decision making. I think our integration with Vizient provides a really great and unparalleled opportunity. We hear from our clients regularly that Vizient is best in market when it comes to the clinical and operational data. And on the clinical side as well of the Vizient expertise, that's obviously a level of expertise that historically we have not had in Kaufman Hall. And I'm really excited about the idea of being able to weave in a lot of that clinical expertise into a lot of the other projects that we do, whether it be mergers and acquisitions or our strategy work. I think there's a ton of opportunity to really enhance what we can offer clients, building upon that expertise.